Hello, this is Dr. Drew Hall with Sarasota Upper Cervical Chiropractic. Today, what we're going to talk about is blood pressure problems in your upper cervical spine. Now, not too many people that are suffering with blood pressure issues would ever think of going to a chiropractor, but I'm going to give you the neuroanatomy behind how upper cervical spine injury can affect blood pressure in the body. In fact, I'll start by saying there was a study published about a decade ago by the nuclei organization. And they're an upper cervical technique that only adjusts the top vertebra in the neck. And they did a research project in coordination with Chicago Memorial Hospital, and they made upper neck corrections on patients and then checked them 6 weeks later, and the average person's blood pressure dropped 18 points on the diastolic. So you might ask yourself, how is blood pressure related? So right over here, this red area right at the base of the skull is called the brainstem. It's part of the nervous system. It's housed by the first and second vertebra in the neck and the bottom part of the skull. Inside of the brainstem are housed many nuclei. They're basically little brains that control different parts of the body, and one of them in there is called the vasomotor nucleus. Now, the vasomotor nucleus's job is to control the muscles that are actually inside of the arterial walls. And so that nucleus basically controls the dilation and constriction of the blood vessels. So if you have a hose and you've got it turned on halfway and you squeeze that hose so you make the diameter of it narrow, what happens? The water shoots out faster because that increases the pressure in the hose when you narrow the diameter of the hose. So a lot of people that have high blood pressure issues, they're the result of an injury in the past that caused the top vertebra in the neck, called the atlas, to misalign and lock under the skull, and that impacts the brainstem and the vasomotor nucleus, and it can cause the arterial wall muscles to be in a state of contraction when they shouldn't be, which raises blood pressure. So in an upper cervical office, if a patient came in, regardless of whether they have blood pressure issues or some other condition, we run them through a battery of tests that tells us, A, do they have an upper cervical spine vertebra that's misaligned and impacting the cord, and B, which bone or bones is it? And then what we do is we take a 3D image of the upper neck, which allows the doctor to see exactly how the joints fit together. Every joint in your body is a mirror image of one another. And so if we find a positive indicator on the neurological test that we run that the top vertebra is off, we'll then take the image between the head and the C1 to see how the joint fits. Because the joints are mirror images of one another, by looking the outer joint margin of the head and C1, we can see, is it even, is it off like this, or is it under like this? And looking at both margins of the top vertebra, we can tell exactly what direction that segment's misaligned. So everybody has a unique misalignment pattern. Everyone has unique angles on their joint surfaces. We're all built different. And so the imaging kind of allows the doctor to come up with the pattern that exists for that individual patient, which of course is different for everyone. Now that information is then used to make a precise correction into the vertebra to take it from being locked out as normal range of motion to get it back in its normal range of motion. And what that does is it allows the pressure that was on the cord to be removed, and then the body starts to go through a healing and repair process. And of course they're monitored. Now every day that vertebra stays in position where it belongs, the body will move towards higher function. And lots of times they come in with blood pressure issues, all sorts of different things that they didn't realize can be connected to the upper neck. So if you've come across this video, it piqued your interest, you're tired of swallowing medication, looking for an alternative, we have an office on the west coast of Florida in Sarasota, and we serve Tampa Bay area, Venice, Bradenton, Osprey, and Sarasota. We offer a free consultation exam. You can give us a ring or look us up on the internet to make an appointment there. Our website is www.sarasota-uppercervical.com. Hope this information has crossed the paths of some people and they'll find the natural help they deserve, and they'll get better. All right, thanks for listening. We'll talk to you next time.